Dr. McHugh, thank you so much for inviting us into your home. It is an honor to speak with you.
Well, that's nice of you to say, but you're very welcome.
It really is. You have been a leading psychiatrist with a career spanning decades, and you've made some bold moves in your career. In 1979, you decided to shut down Johns Hopkins Gender Identity Clinic, and I believe it was the first clinic to provide what was commonly called at the time sex change operations. What was behind that decision in 1979?
Well, first of all, I thought that this was a very radical idea, and I was always concerned in psychiatry for the radical, imaginative ideas that seemed to be controlling it for the middle of the century, primarily in the middle of the century with the Freudian enterprise. It turned out that when I arrived, there was already a member of our faculty that was deciding to follow up on these cases and to see in what way they were better or worse. And it turned out that although most of the patients at the time felt that they had done the right thing when they subjected themselves to the surgery, all of the issues that they said was going to be corrected, their difficulties in interpersonal relationships, their difficulties in their jobs, their difficulty with their families, which was the whole reason for doing it, they were not better. They didn't improve. And so it didn't seem to me that this experiment was working out. And it was just then an experiment, after all. It wasn't that they knew perfectly well that these patients would benefit from it, but they thought they would benefit. And when they weren't benefiting, at least in this way, I thought, well, why do it? Let's find another way of helping them. That was it was fairly simple.
Right.
It didn't seem that at that time that I was doing anything awfully radical, because in those days, we're talking in the late 70s,
right,
we didn't think we were making women out of these men, because they were mostly men. But we thought we were helping them with a psychological problem. We thought the experiment was that we would help them.
So to be clear, shutting down that clinic, it was not driven by ideology. It was driven by the evidence.
By the evidence, yes. We had evidence there that the patients really weren't any better. And it was just about, we'd been doing it for about 10 years. And so we had sufficient number to say that they were not benefiting.
You weren't seeing them have the benefits after the operations. What does true psychiatric care look like for someone who is experiencing transgender identifying beliefs?
Well, it's like many other kinds of things. It's individuated. It's an aspect of their demoralization about their situation. It's usually a matter of finding some other explanation that for the demoralization, the sort of sense of helplessness that they have. And so all I was saying is, the surgery isn't the way to do it. Let's start searching for another reason. Is it some aspect of their sense of control over their life? Is it some aspect of their sexual being? What have you? I said, go out and look.
Right.
Go out and look.
Let's find the facts.
Let's find more of the facts, and let's see if we can't help them in another way. Because this is a radical. I mean, it was a pretty radical procedure, and I didn't think at the time even that we'd had enough experience to be able to justify such a radical procedure.
And that was in 1979. What have you observed from your area of expertise, on the so-called transgender movement from 1979 until now in 2026? Have you been surprised by the momentum that it picked up?
I was astonished by it, because it didn't seem to me that we were doing anything terribly radical. But gradually the idea became that somehow or another we were denying these people their honest sex. And I kept saying, look, we're two things here. We have the facts of the body and we got the ideas of the patient. And I thought that was one of the kinds of things where psychiatry has gone wrong in the past and could go wrong again. Imagining things rather than knowing things.
You talked about how extreme and dramatic of a procedure these transgender operations are, and how the surgeries provide little change to psychological health after surgery. You don't support it for adults or children, but can you talk a little bit about the psychiatric impact specifically on children who undergo these operations or any so-called gender-affirming care?
Yeah. Well, I think we don't know enough about it because we're not spending enough time studying them. I wanted more and more study so that we could understand how this idea had taken such a firm hold on them. To tell you the truth, even now arguing about it, I say, why are we still arguing about this? It's so obviously a mistake.
And there really is an impact on children who take puberty suppressors.
Oh yes, The whole idea of doing this to children to slow down and presumably get them to think more about what they're experiencing has been a track towards, in fact, persuading them that, and has not been a good idea. I've, after all, seen a lot of young people taking on, and they're very susceptible, especially young girls, to being persuaded that there are some aspects of themselves in their body that needs correction. It's really the foundation of anorexia nervosa and things of that sort. So I felt that this was speaking to a weakness in young people, and that if they were not supported in this, they were encouraged to just grow up and let their body take it. It turns out that 85 to 90% of them drop off of this. So if you don't treat them with gender affirming or so-called gender affirming treatments, hormones, or surgery, they gradually give it up. And as life itself comes to take on the appropriate role.
Yeah, that puberty is such a vulnerable time.
Oh yes, it's a very vulnerable time, especially, all kinds of things are changing in your body and in your mind. And as well, though, once you get past it, once you get through puberty, a new kind of person comes to think about what the life is going to be like, what they would commit themselves to. Human beings are different from animals, as I've said in a paper, that animals, when they get to go through puberty, just become what they were from the start. Human beings have a kind of rebirth after puberty as they think in terms of who they are and what they would like to do. And those ideas would be best appreciated and filled out if you were what God made you, as it were.
Well, and you have stated publicly multiple times over the years that you thought it would be lawsuits that ultimately are what take down surgeries for minors. Well, 1 month ago, in a legal first, the first malpractice verdict about transgender surgeries providers, a jury in New York awarded a woman $2 million in damages for a double mastectomy she received as a teenager that she says has left her disfigured. She accused both her psychologist and her plastic surgeon of failing to obtain adequate consent and about the risks before she agreed to the procedure. Dr. McHugh, the first malpractice suit now, is this the end of transgender surgeries for minors?
Well, I'm not sure. I think it should be, but there are going to be many more lawsuits coming down the pike now, as I predicted it would come. This is one of the problems with psychiatric inventions that often doesn't get sorted out in the clinic. It gets sorted out in the law. 2 million is a small thing. It's going to be a lot higher as more and more people come to realize, and they're going to be mostly women in their, mid-20s. They suddenly find themselves with 5 o'clock shadow and low voices and mutilated, and they're going to come and say to their parents, "Why did you let them do this to me?" And they say, "Well, the doctors told us that you'd perhaps commit suicide if we didn't do this." And I said, "Well, you should have held on and at least let me grow up to decide myself as an adult." And the parents say, "Well, we were doing the best we could, given that you were transgender." "Well, you see, I'm not transgender." And I go back to the doctors, and the doctors will say, "Well, we couldn't tell you then that we couldn't be sure who would transition happily and who would And that'll be an amazing event when that happens. So suddenly the doctors themselves, it turns out, were uncertain.
And these financial repercussions of the lawsuits.
They're going to be big, I'm afraid. And to some extent, you have to remember, all of these people thought they were doing the right thing. They weren't people who were trying to do something wrong. They were trying to do the right thing. It's just they let their imagination carry them along rather than observing the facts.
We're coming up soon on 10 years since you released your 2016 special report in the New Atlantis on sexuality and gender. And if I have it right, in that report you state, there's no scientific evidence to support sexual orientation is biologically fixed, and benefits of sex reassignment surgeries need to be viewed with skepticism. At the time, your colleagues, at Johns Hopkins took out an op-ed in the Baltimore Sun. Were you surprised with how much pushback there was to that 2016 report?
Well, I suppose I shouldn't have been surprised because, the truth of the matter is many people want to know the answer to a question, but they don't want to have an answer that they don't like. And if you start just asking the question causes them anxiety because they want a particular answer. But so I wasn't particularly surprised that that it didn't go down easily. But I just think we ought to continue asking the question because it's a very important question.
And it's seeking truth. So what do you say to critics who maybe discredit your work because they'll say, "Oh, well, he's just making these claims because he's Catholic"? They discredit your work because of your faith. What's your response to those people?
Well, I first of all, I say I am Catholic, and I can't tell in what way my faith influences any of the things they do. I'm sure that it's important in everything I do. So I can't deny that it may play a role. Like I was able to say, "Look, I'm the Henry Phipps Professor of Psychiatry at Johns Hopkins. If I can't ask these questions and listen for their answer or offer my suggestions as to what the answers are so far, who can?" We're just going to... This is America, for crying out loud.
And you speaking out enabled more people to speak out. You
That's
helped
right.
pave the way for truth-telling.
Because, they can say, it'd be wonderful if they could say, "Paul, you're very wrong about this because here is the good evidence and here's how we ought to act in relationship to the evidence." But if you can't ask the question, you're not going to be able to get any answers.
It seems a few times in your career, you've not been afraid to be a truth teller. And sometimes there's been controversy surrounding that. I'm just curious, as a devout Catholic, anytime you have faced backlash in your career, is there a specific prayer or devotion you turn to? How did you lean on your Catholic faith during difficult times in your career?
Well, my Catholic faith developed from my childhood. I had a lovely family, and I was enriched by the encounters that I had with the church fathers and the sisters that were instructing me on why God made me to be happy with him in this world, love him in this world and be happy with him forever, and all of that. And then when I got into college, I hadn't given much thought to it. It was just part of my being. And in college it was that it began to appear that many people challenged my faith. And I thought, I remember walking down Mass Avenue, actually, right by. I thought, they want me to stop being Catholic, and they're miserable. And I come from happy people, so maybe I ought to study it more. It was more that. And then I woke to what good things that they, the Catholics are realists, and I felt very much at home with the realism.
Looking back at this career that you've had, what do you want your legacy to be?
Well, I don't know about what my legacy is. I want people to think, though, that, as I always say, I want them to think that I was part of my times and that I didn't shy away from the things that occupied the attention of my fellow Americans. I think it's really important to see that the role you have calls for certain kinds of courage. And if you don't have that, you shouldn't have that role. And I had some adventures. And it turns out I was right about a lot of things. That's the fun part.
Last question, 94 years old. Any plans to retire?
No, I'm not retiring yet. I'm going to see if I can't go a bit further. God got me this far. Maybe he'll carry me on another while. I've got wonderful grandchildren I want to see more of and see how they flourish. Anyway.
Dr. Paul McHugh, thank you so much.
You're very welcome.